Dr. Acree, I'm Danny. Nice to meet you.
Nice to meet you.
Hi, I wanted to interview you a few questions if you don't mind.
Absolutely.
All right, first question, I wanted to ask you, what could be a reason why you wish to be an academic pharmacist?
I love to teach, so during my P4 year, I started helping some students in pharmaceutics, and I really, really enjoyed it. They were smaller groups, but I still really enjoyed kind of that aha moment that students have when they finally understand something. And then also during my P4 year, I did a rotation with Dr. Herdman, where I actually got to teach a little bit. She taught me how to write a syllabus, how to write test questions, those kind of things.
Oh, wow. You said pharmaceutics?
Mm-hmm.
How was that?
I love pharmaceutics.
Oh,
like, I could do pharmaceutics all day long. I love the math part of it, so
Oh,
I really
see.
enjoy it.
I see. But you are also a pharmacist, correct?
Mm-hmm.
So what makes you motivated to become a pharmacist?
Just really helping patients, helping students. There wasn't really a moment. A lot of people have a moment in their lives where they think, oh, the pharmacy is absolutely for me. I just kind of tried it out and I loved it. I worked in a compounding pharmacy right before I started pharmacy school, and I absolutely fell in love with pharmacy. So that's kind of what my deciding factor was. And then I found academia when I was in my P4 year.
Oh, that's good. So you started, you're also residency too, right?
Yes, I did a residency
And
as well.
that was after?
That was after pharmacy school.
Oh, I see.
Mm-hmm.
So when you did your residency after graduating from pharmacy school, do you think that helped your career decision?
I did a residency that was more focused on what I wanted to do. So I wanted to do academia. I really wanted to do ambulatory care, so having an ambulatory care clinic. And the residency that I did, which was here at UC, was kind of geared towards both of those things. So it was really the perfect residency for me. And it really did help because you really have to have a one-year residency in order to teach. And I really wanted to stay here at UC, so yeah.
So at least 1 year, right? So people
At least a year, yes.
So when they go for 2 years, what is that usually for?
A second-year residency would be more specialization. So if you want to specialize in ambulatory care or pediatrics, something like that, you would do a second year.
Oh, I see. So how difficult is patient care in your view as a pharmacist?
I don't think it's very difficult at all. I love patient care, and that's why I love ambulatory care, because I actually get to spend time with the patients. So it's not like in retail. It's a little bit more difficult because you're pressed for time all the time. You don't really get to spend very long with the patient. But for what I get to do, I get to see patients and I can hang out with them for 30, 45 minutes, an hour, just however long it takes for me to start from the beginning and explain their disease state, explain their medications, what they can do to help themselves, those kind of things. So I love patient care, and that's why I love AM care.
That's good. That's good. The thing about you mentioning how retail is different than the ambulatory care, do you also get stressful patients, like the one that are really problematic in ambulatory care?
Oh, absolutely, absolutely. You get the patients that their labs are completely out of whack with their diabetes is completely out of control, but they don't want to do anything to help themselves. So you can talk to them about diet, exercise, and all those kind of things, and they don't want to do any of it. All they want you to do is give them more medicine. So that, for me, is a little bit difficult because I would rather take patients off medicine and have them make lifestyle changes than add medicine. So that's a little bit difficult when I have those kind of patients. But I just try to work with them and take baby steps with them just to kind of get them started. Because once they get started doing those lifestyle changes, then they tend to kind of roll.
I see, so they just go with that afterwards.
Yeah.
Oh, that sounds. And also, have you been involved in any advocacy group in relation to the profession?
I haven't been involved in any groups. However, during my residency, I kind of took up the idea that I thought that all daycare workers should be immunized with Tdap for pertussis, because I didn't realize that they weren't until I was in my residency, talked to the daycare director where my son goes to daycare, found out that none of their employees had been vaccinated for pertussis. So I ordered a bunch of pertussis vaccines, and I went down there and I gave all of them shots. So, and I want to do that. I want to continue to do that. So even though it's not through a group, I'm still trying to make an impact at least locally, and then kind of expand it going forward to try to get all daycare workers immunized. Because in the schools, they have to be immunized. So Kanawha County Schools, all their teachers are immunized, but they're not dealing with those really small kids that are most at risk. So.
Nice. But when you do shots for them like that, they also have to sign something too, right? Or,
Absolutely. Yeah.
Of course, the agreement. Right?
Yeah, they have to do an agreement, and luckily the daycare it's through a church, and they actually paid for the vaccines for their employees, which was a really good thing. So it worked out very nicely.
I see. There's also one thing we want to check with you. Are there any pharmacy laws and legislative rules of West Virginia that you do not agree with?
Not in particular. There's a few that have come about that I don't necessarily agree with. The one, for example, is the Sudafed law that they've been proposing to make it prescription. I don't agree with that. I think it would help with the meth problem that we have here in West Virginia, but at the same time it penalizes the patients that maybe can't afford to go to the doctor. They can buy the over-the-counter Sudafed very cheaply. And start to feel better. But if they have to go to the physician, that's more money out of their pocket. Even if they buy the tamper-resistant, that's more expensive. So it still kind of penalizes those patients, and I don't agree with that. But that's a personal opinion. So
that's a good opinion. I agree with that one. As a pharmacist, do you have time separate from work to do hobbies, spend time with the family, or are you so busy with ambulatory care too?
No, actually, I do have time. My evenings I try to keep for my family. So I have 2 kids. One's 3, one's 6. So I try to play with them when I go home. So I try to leave work at work. Sometimes that's not always possible, but I just basically I put them to bed, and then once they're asleep, I get up and do what I need to do. So if I need to work on a lecture or something like that, I can get up after they go to sleep and work on it. But for the most part, I can keep them pretty separate.
Really busy though, right? Academia.
Yeah, it is very busy, but I try to do as much as I can while I'm here.
Did you always want to be a pharmacist? If not, what else did you want to do originally?
Well, I actually started out as a photography major. So when I graduated high school, I knew I wanted to go to college, but I didn't know really what I wanted to do. So I started out as a photography major, switched to interior design, did a few other things, And then I finally, when I got pregnant with my first son, I decided that I wanted to be a pharmacist. I figured that I needed to grow up at some point, so that was kind of my grow-up moment. So then I looked into pharmacy. I worked for an independent over the summer, loved it, and that's really kind of how I decided that I wanted to go into pharmacy. And then, of course, once I got into pharmacy school, I really kind of got into ambulatory care, academia, all that
That's
kind
when
of
it
thing.
started growing, right?
Yeah, absolutely. That's when I really kind of found my niche that I wanted to do.
I see. So you don't regret anything in pharmacy though, right?
Oh, absolutely not. I keep my artsy side, so I still love to do photography. I love to paint. I love to oil paint. So I do those kind of things on the side to just kind of, keep my arts part of me still alive. So I like to bake and make cupcakes and things like that.
Oh,
so,
that's good.
So yeah, so I like to do a lot of artsy kind of things on the side to just kind of keep that. But I realized going through, photography and interior design that I love doing those things, but that's not really what I wanted to do all the time and try to make money for it and, all those kind of things. It's kind of more of a hobby.
Did the money factor, was it incorporated into your decision as well? Did it just because
not really. It was more of I enjoyed it, and I didn't want to ruin my enjoyment out of it by trying to ask people for money for me to do it. You know what I mean? So, because it's more just I wanted to go out and I wanted to take pictures and I wanted to paint and things like that, and then not having that pressure of trying to pay the bills with it. So, but pharmacy is a little bit different, and that's the money of course is good with pharmacy. But I really love what I do. I love waking up in the morning and coming to work, and I love helping patients. I mean, I have so many patients that I get to see over and over, and they're great. I mean, it's just I love coming to work, so I don't regret it a bit.
That's good. Well, thank you so much, Dr.
Thank you very
for
much.
everything.
No problem.
Have a
Thank
good
you.
day. Was that appreciated?
I think that was good.
Good?
That was good. So it shows.